Dr. Naresh Trehan is with us. Sorry to keep you waiting, sir. We just wanted to play out that full report once so our viewers, had the context of what we're talking about. My first question to you, sir, is obviously, it seems like there is a spate of these incidents because these videos are viral. People are watching them on social media, in the media. So it's kind of unsettling to see people collapsing all over the place. Is there an issue, sir? Is there an actual issue of more young people having heart attacks in your experience?
You see, first of all, it has to be all put in perspective.
Yes.
This random thought process is not going to take us anywhere because the public must understand what are the risk factors in their life which they can have control over. So the first thing we say is know your genes. We know today that if you have family history of heart disease, then the children will have double the chance of developing early heart disease. Second, if you have history of diabetes in your family, then the children in that family will have double the chance of developing diabetes. And if unfortunately somebody has both in the family history, then the red flags are up 3 times.
Yeah.
So basically, one, if you have genetic propensity in your family, in addition to the fact that Indians generally have a higher propensity for coronary artery disease than the Western world because of many factors about our diet, our lifestyle, sedentary lifestyle, stress levels, and on top of that, pollution that has caused another, as you can see, we talk about must stop tobacco. Not smoking and chewing is bad. Now we also know that in the worst of times, when in Delhi area, actually it's all over the country now, that when the levels of pollution are so high, you're actually smoking almost 10 to 15 cigarettes a day. So all these factors have added on, and the basic fact is that one can only help themselves by knowing your genetic and your early biochemical makeup of your body. So what we suggest is people who have family history of diabetes or heart disease, they should have their first checkup before the age of 25 because we would like to identify what are the risk factors.
Yes.
If the risk factors are identified, we can actually work towards eliminating or reducing them. The second thing we say is everyone by the age of 30 must have had a full checkup because we want, what are the enemies right now that we are talking about?
Yes.
We're talking about the genetic factors means your biochemical factors show that you have high lipids, you have high the apolipoprotein A, all these deficient factors which actually lead to heart disease. Second, we know whether you have a propensity for developing diabetes. Third, we know that what is the physical makeup of your body, how much fat content you have.
Yes.
So all these things if we are identified, and it's not single factor, but multi-factors which actually contribute to heart disease. So now, if you see today's science, what we have done is we have a sequencing of genome available to everyone at a very reasonable price, 8 to 10,000 rupees. You can get your whole genome sequence, in which we know that there are 3 diseases in which early gene detection has been done. So we know that for cardiac disease, the gene detection is done. So if you know that your propensity, then you will be more careful about avoiding things that are contribute to heart disease.
Correct.
Second is diabetes. Similarly, you know that there are genetic genes will tell you. And also third is cancer, which is now the new big problem that we are facing today. So all these things put together will actually tell you where you stand genetically. We add to it what we call phenome. Phenome is lifestyle, your sleep patterns, what you eat, how you live, what kind of work you do, what stress factors you add on, and that's the second thing.
Yes.
And the third is the digital health, which we can measure to say how is your heart responding to exercise. Are there any abnormal changes which were genetically born in you? Because there are There are problems that you have diseases which are genetic can cause a problem.
Correct.
So all these three things put together, we can come up with an algorithm to tell a person today, which is what we call precision individualized medicine, in which we can tell an individual what are the risk factors to their life. In other words, make a health horoscope for them.
Very extremely useful.
That is possible today. That's possible today. And this science has helped many, many people to actually steer their lives accordingly. Now, add to that, as you have mentioned earlier, COVID produced
a lot
that's
what I was going to ask.
Yes. Okay. The COVID produced a lot of inflammation in the small arteries, what we call arterioles of the lungs, of the heart, of the kidneys, everywhere. And people who had severe COVID infection, their myocardium has been actually damaged by the virus itself. So if you never had a checkup after post serious COVID, you're not aware of the fact that your heart function is down to 25-30%.
Wow.
And if you indulge in any physical activity or any excitement activity, you can suddenly have an irregular heartbeat and actually pass away. So that's why we have to first be careful in today's environment that we get a regular checkup, the first checkup in the people who have, I'll reiterate again, before 25, the ones who have history of disease in their family, by 30, everybody, because one of the main contributing reason for disease throughout the body is high blood pressure. We did a study of 10,000 executives who came for the checkup to Vedanta, and we found that 26% of them had high blood pressure, which they were not aware of.
My God.
This is a very serious consequence because high blood pressure in today's day of pollution, high stress, work pressures is producing damage to the entire body, to your brain, to your lungs, to your heart, to your kidneys. So we are seeing a lot of kidney failures for unknown hypertension. So I think that there is a lot of currency and it's not expensive to get a full checkup, which will give you guidance for your life. And I think with that, you will discover if there are any inborn or lurking dangers for you, and you can actually live your life according to those limitations and try to modify your risk factors.
That's a very extremely comprehensive list of things to think about and to do for anyone who's watching, Dr. Trehan. Also, apart from the things that you mentioned, are there any new warning signs that you are noticing or you're advising your patients about? Are there some new things post-COVID that people should be aware of, sir? That that may be causing heart attacks?
See, one of the most missed symptoms is headaches. People think that headaches are, I've been stressed, I've been putting too much of blue light into me from my computers and all that. But you can miss high blood pressure, which can cause damage to the brain, which can cause damage to the whole body. So not to miss symptoms that appear early. If you are walking or brisk walking or trying to do any exercise, even when you are young, if your heart rate goes up too high or you get short of breath, best thing to do is to get a checkup. And we always recommend that if you're going to do vigorous exercise or iron pumping, you must get a full cardiac checkup before you do so, because you don't know what defects you have in your heart, which can actually under stress manifest themselves and be fatal.
Right.
So I think there is just a warning to everybody that India has one of the highest incidence of heart disease in the world. And it could be genetic, it could be at birth, it could be acquired by your habits. And also now alcohol is also incrementally being recognized as which weakens the heart muscle. So your heart pumping, which is normally 65%, if it goes down to 30-35%, you're prone to irregular heartbeats, which can kill you in a minute. So that's why we are saying, when we say we see people who are collapsing, dancing, singing, running, bicycling, and you just saw the groom collapse before, all these things raise your heart rate, and then if you have an underlying problem, it will manifest itself. So best thing to do is,
Absolutely.
before you indulge in any, get a checkup.
Dr. Trehan, always most useful to listen to you, and the warning signs are there. It's easy to be unsettled and troubled by viral videos, but these are all serious and separate cases that we need to take seriously. And we will continue to repeat what Dr. Trehan has just said on this show, because we've gotten frankly, so many queries from our viewers about this. We were actually requested to do a show putting the spotlight on this issue because people are genuinely troubled and worried. So we'll be putting this out again. Dr. Trehan, appreciate it, sir. Thank you very much for giving us your time and your advice here on India Today. Well, that's a wrap on 5 Live. Thanks for watching.